So why IVF fails? A failed round of IVF is heartbreaking. You've put a lot of effort and hope into the process, and if you just failed, I'm so sorry to hear that. But you should remind yourself that just like you won't become pregnant every time you have sex, even if you don't have any fertility issues, IVF can succeed every time for everyone. And your doctor may often not be able to give you a straightforward answer as to why treatment failed. But it's still important to evaluate and learn for the next attempt. Because fertility is complicated, and often we diagnose patients throughout treatment, by trial and error, you could say. So basically, the more we test and try, the more we learn and can adjust treatment according to your unique needs. So my hope is that by informing you which factors can play a role and how they can be examined, you'd be able to have a more informed discussion with your doctor regarding what's relevant for you and what can improve your chances. So what are the main reasons for a failed IVF cycle? Well, if I would simplify it, I would say there are mainly two reasons. Either the treatment haven't produced any embryos of satisfactory quality to transfer, or the embryos you got did not implant. If you didn't get embryos to transfer, that could be due to a lack of eggs, or a lack of sperm, or having both egg and sperm, but sperm failing to fertilize the eggs, or what we call arrested embryo development, which is when embryos stop growing or behave abnormally in the lab before transfer. So we got eggs out and we got sperm, but nevertheless, no embryos to transfer. How is that possible? Well, not all eggs and sperm have normal chromosomes, so both egg and sperm quality play a role here. Low sperm quality, it's easier to test. To some degree, it can be detected via a semen test, and ICSI, which is a specialized fertilization method, can be used to overcome it. But egg quality, on the other hand, it can be proactively tested. Instead, it's usually suspected in case the embryo develops abnormally. And egg issues are especially suspected if the embryo arrests during the first 3 days, as the maternal genome is in charge of cell division during this early period. Sometimes egg and sperm quality can be optimized with lifestyle changes, such as by quitting smoking. But there are also factors, like age, that are harder to alter. IVF in itself can't really create better quality eggs. What it can do is, as long as you have a high enough egg reserve, help you retrieve more eggs to increase the chances of finding healthy ones. If you're not able to retrieve healthy eggs or sperm, using cells from egg donor or a sperm donor could be suggested. It's also worth to mention here that embryo growth is the most sensitive step during an IVF, and it's very important that the lab handle embryos correctly and provide a good culture environment. If you instead do get high quality embryos, but they don't implant, there are two major factors that could play a role. There could be something wrong with the embryo, or there could be an issue in the uterus, not allowing the embryo to implant. So, now focus on the embryo. Even if the embryo looks good in a microscope, which is how an embryologist examines it, it could be nevertheless abnormal, having an abnormal number of chromosomes. This can be tested with what we call PGTA testing, which stands for pre-implantation genetic testing for aneuploidies, and it could be recommended after a few failed transfers. PGTA, however, is not permitted in all countries. So now focus on the uterus. It's usually in the endometrial lining that the embryo is about to implant, and there are some things that could create an issue. There could be anatomical issues like congenital anomalies of the uterus, or structural issues like fibroids or scarring. Most of these issues can be detected with hysteroscopy, which is a procedure where we examine the inside of the womb with the use of a camera. There could also be issues with the thickness or the structure of the endometrial lining. During IVF, you normally need both estrogen and progesterone to optimize the growth of the lining. Estrogen and progesterone can either be produced by your ovaries, or you can receive them as medications taken either orally or vaginally. Different patients, however, respond differently to these medications, and dosages could therefore be adapted for an upcoming treatment if the lining thickness or the structure did not look good. So sufficient progesterone levels are important in order to make the endometrial lining mature, but they're also important after implantation in order to support the pregnancy early on. And if you suffer from several early losses, doctors may check your progesterone levels with a blood test, and they may add or increase your progesterone medication. But progesterone levels should not be too high too early on. So many doctors measure progesterone levels at the time of egg retrieval during an IVF cycle, especially if a fresh transfer is planned. If progesterone levels are too high, there's a risk the uterine lining is overmature when it's time to transfer, so embryo transfer can be postponed. Lastly, there are theories that immune issues, for example, high levels of NK cells, may also play a role after failed IVF attempts, and some doctors take immunological tests in order to test for them. So to summarize, there are many things to consider. Some factors should be tested straight away, like congenital anomalies of the uterus with a pelvic ultrasound. But some tests, because they are more expensive or more invasive, they are more appropriate to test if you're unlucky enough to fail several times. And remember, with IVF, a failure doesn't mean you will never succeed. It might just be a matter of time.